Nurse, are we ready to start this patient's ICD implant? Why isn't my patient asleep?
No, doctor. You have not signed the consents, or updated the history and physical exam. And you have not marked the surgical site.
I just saw the patient yesterday in the office and completed all the paperwork. Did the hospital lose all my work again? This guy asked so many questions.
No, doctor. Your paperwork is in the chart, but you know that you have to update the information preoperatively.
I hate all the paperwork. Why can't I just operate on patients these days?
Besides, doctor, this patient insists that he talk to you again. He says that he did not get to ask all of his questions yesterday. And he thinks that you are planning to put in the wrong ICD.
The wrong ICD? This guy is killing me. He has a chronic ischemic cardiomyopathy and his ejection fraction of 20% has been less than 35% since his coronary bypass surgery 6 months ago.
He says that he was up late last night doing research on the internet and that he thinks that he needs a Medtronic Protect the Cardiac Resynchronization ICD.
What? This guy is crazy. He has mild New York Heart Association Class II chronic systolic congestive heart failure and normal sinus node function. He needs a single-chamber shock box system.
But doctor, he has a friend that has a CRT ICD system and the friend feels great now.
His QRS is narrow and he does not meet criteria for biventricular therapy. I am not putting in a CRT ICD system in this patient.
Doctor, he says he has Medicare and has paid his dues and deserves the best device money can buy. He thinks you are discriminating against him because he is 85 years old. He says that he is short of breath during sexual intercourse and both he and his wife think that resynchronization therapy with the left ventricular lead will improve their sex life.
I could care less about their sex life. She is 85 too.
And he wants the Protect platform to help prevent unnecessary shocks. One of his friends had multiple shocks due to atrial fibrillation and he knows that due to his age he is more likely to have atrial fibrillation and receive inappropriate therapy.
Can we hurry up and put him to sleep? I don't have time for all of this talk. I have signed all the paperwork and updated the chart.
Doctor, he wants to make sure that you are not going to use that Fidelis lead and that you plan to use the new 4096 bipolar left ventricular lead.
Medicare will not pay for a CRT ICD system for this patient and he does not meet criteria for anything but a standard primary prevention device and I am not going to commit Medicare fraud.